There we go. Hey, how are you?
Good. It's great to be here. Got stuck on the road, so I have to do this from the car. I'm so happy to join you to discuss how diabetes can impact your eyes.
Absolutely. So I have a few questions and answer, guys. And if you have questions and we have time, drop them in the comments. And if we get to them, um, we'll see. Okay, so my first question, as someone who's living with type 2 diabetes for a really long time, why are so many individuals with diabetes not diagnosed with diabetic eye disease?
Well, the most common reason is not being evaluated by the eye professionals, whether it's optometrists or ophthalmologists. As you know, as a diabetic, you need to get your eyes checked once a year, whether it's optometrist, whether it's ophthalmologist, whether it's through taking photos and artificial intelligence reading it, you need to go in to see your doctor. So your regular doctor should refer you to see an eye doctor. And if you don't see a regular doctor, you won't see an eye doctor. So the most important thing is to follow the advice of your diabetic doctor. And if you don't do that, over 5 to 10 years, you can start having damage in your eye. And we can help with that if you come in at the right time. And if you don't, then you end up having some impact on your vision.
So we need to be proactive about making those appointments and keeping them, is what you're saying.
Very proactive. Yes. It's like having control of the disease. You will win if you take care of diabetes. I have patients with 40 or 50 years of diabetes, no vision loss, perfect looking retina. So you
Awesome.
have to be proactive. And I'm glad you and Calvin and others are having this campaign to really help people understand what diabetes is and how to take over the diabetes.
Yeah. So if I've been diagnosed with diabetic macular edema, what treatment options are available to me and how do they work exactly?
So diabetic macular edema is leakage in the retina. Retina is the camera film, so your vision starts to get blurry. If you have mild edema, we don't do anything. We ask you to watch your sugars, exercise, control your blood pressure, and if it starts to impact vision, very swollen, the older treatment was a little light laser on the retina to stop the leaky vessel. Now the first line agent is actually doing injections in the eye. I know they sound scary, but they're not. Every time I do one, patients are like, oh, you're done, and that's it. So we numb the eye very well. We inject this medicine in the eye that stops the leakage, and then you have a response right away. Within a week or two, you start to see better. And then depending on how bad the edema is, some people need multiple injections, some need two or three. And I think the more you control your sugars, the less injections you get. So while the damage has happened, we can help you reverse the vision loss. At the same time, as a patient, you need to continue to control your diabetes.
Gotcha. So that kind of goes into my next question, which is how long typically does the therapy given for DME last? So
Yeah,
does it vary from patient to patient?
correct. Correct. It's very different for each patient, and every patient responds differently. Some patients get better within 1, 2, or 3 injections. The other may need a series of injections for 1 to 2 years. But the good news is that diabetic macular edema, is not a lifetime injection disease. So if you control your sugars and you let us do our job and you come in at the right time and keep your appointments, you are going to be able to preserve your vision and not lose vision over time. The most critical thing that happens in real world is patients get too busy. They are working, they have multiple doctor appointments. It's a disease that's very difficult, as you know very well. And what happens is, okay, do I go to the eye doctor or the kidney doctor? Do I go to my podiatrist or go to the eye doctor? So I think, and then you have to work also and sustain yourself, and you only get so many days off from work. So it becomes very, very difficult. And I really feel bad when I have a patient who cannot come in because of the reasons I mentioned. And my job as a doctor is to see them whenever they can come in, to be flexible to the patient, and also communicate with the primary care doctor, even the work. I mean, I write letters and get approval to come in to see us once a month. Usually, initially, I see once a month for the treatment. So the most important thing is that as doctors, our goal is to preserve your vision. As patients, you need to make sure that you come into the appointments and ask us for things we can do to help you come to the appointments.
Right. So how important, you mentioned once a month for injections. Is that what you were talking about? So what happens if I miss one? How do we get back on track, and how detrimental to the treatment is that?
So that's a good question. Diabetic macular edema is slow. It's not very fast uh, disease. So even if you miss an appointment or injection, we can catch up. And the good news now is that we have medicines that can go 3 to 4 months now compared to the past. So initially you get a series of monthly injections. Once we continue treatment and control the disease, then we extend the treatment. And if I can get you to 2 to 3 months between injections, I stop and then I let you kind of take control of the disease by controlling the blood sugars and keeping yourself healthy. So initially once a month, and depending on how you respond, we can extend as far as 4 months. And there is a second category of drugs called the steroids, which can go longer, but obviously it has some side effects. So they're not the first line treatment for diabetic eye disease. The first line treatment is called anti-VEGF. These are drugs that stop leaking vessels.
Okay. So you mentioned controlling blood sugars as kind of like our part in treatment. How do we just go by the range that our medical doctors give us, or are you, as the ophthalmologist, um, providing us additional guidelines to that?
No, I think you go with your primary care doctor. They are the main contact for the disease control. Lower the A1C, the better. That's what we
Okay.
go. I mean, if you can get down to 7 or 6, that's much better than being at 10 or 12 or 15. What we see is that patients who are uncontrolled have much worse disease, and they also don't respond as well. So sometimes what I've seen is that when patients get diagnosed with DME, they realize that getting an injection in the eye is not a great idea, and then they start controlling their diabetes, and they never get injections. So that's
Yeah,
something to keep in mind, is that diabetes affects the whole body, and it's our job to take control of this disease so we cannot have any impact on any of our organs.
absolutely. So you said in Kelvin's live and also on this one that coming to see you or going to the ophthalmologist or optometrist at the right time is key. What is the right time? What does that mean?
The right time is, so obviously you have to be screened every year if you can. If you cannot go, the right time is every time you have new symptoms in your vision. Center is blurry, as Kelvin said. If you're seeing some floaters or any black spots in the vision, a shadow. So many times diabetics who actually end up with permanent vision loss are the one who have ignored their symptoms for months because they had bleeding in their eye from diabetic retinopathy. Then the retina gets pulled and detached, and they feel like it's going to get better. And it doesn't get better. And then when they come to us, we can do surgery for it. Now, that's a different problem than DME, but we sometimes cannot salvage all the vision. So that's the thing. Any new symptoms happening in terms of blurriness, floater, shadow, curtains, anything unusual, please go see your optometrist or ophthalmologist. And then I come in when there is an acute problem, whether you need injection or surgery, and we can do our best to help you.
So ideally, we're going once a year as preventative measure. And if for whatever reason we cannot keep up with those appointments, it is, you're saying, of the utmost importance if we have any new issues to call and make that appointment. Don't wait.
Correct. And I'd rather have you make an appointment if you miss your yearly, go in a year and a half or 2 years, depending on how long you have had the disease. Are you type 1 or type 2? How the control is. Sometimes you can go less often. But as long as you have somebody that is keeping an eye so that we can stay ahead of the disease, not try to catch up later.
Gotcha. Okay.